Welcome everyone to this webinar about unlocking the power of synthetic data in healthcare. I think for the introduction, I will hand the word over to Juliana.
Hello everyone, you're welcome to our webinar about unlock the power of synthetic data generation in healthcare. And also today with me and Wim, we are welcome Edwin van Unen, the principal analyst and consultant at SAS, and also Frederick Dropper, legal professional and BG Legal. So welcome and thank you for joining us today.
Thank you.
Thank you.
So yeah, you're welcome. So we will start today with the agenda. So today we'll speak with our panelists about the some challenges in synthetic data and how to overcome them, some use cases. And then we also do the introduction into synthetic data, and then deep dive into synthetic data itself and some healthcare use cases to give you an idea how you can use synthetic data. So some practical information. We will have two Q&As. So one after the panel discussion and another one after synthetic data introduction. So you are welcome to write your questions in the chat, and I will highlight them either to panelists or to Wim after the presentation. We will also have today a live demo to give you an idea about the platform and how it's easy to generate synthetic data and integrate into workflow. So I would like to start to give a floor to do the introductions for our panelists and also for participants. So maybe I will start from myself. So hello everyone. My name is Juliana Krajinska. I'm Business Development Executive at Synto. And today, together with me, Wim Kees.
Thanks. My name is Wim Kees Jansen, one of the founders of Synto, and looking forward to deep dive together with you into synthetic data generation. I have a background in the financial sector, being responsible for the development of data and tech solutions. Typically work with privacy-sensitive data, and that was my motivation to start building smart solutions. In this case, synthetic data generation. I'm looking forward to deep dive together into that with the panel and with the rest of you.
Oh, nice. Frederick?
Yeah, thank you. I'm Frederick Dropper. I'm a legal professional at BG Legal, a law firm in Den Bosch. And personally, I specialize in IT because I'm originally also schooled in IT. So everything tech related, and especially now here for the webinar relating to synthetic data, I like to give my legal opinions.
Yeah, great. Looking forward to it. And Edwin?
Yes, thank you. Yeah, my name is Edwin van Unen. I'm, like you told, a principal analytics and AI advisor at SAS. I'm based in the Netherlands. SAS is a US company, but I work in the Netherlands and serve different organizations like hospitals, but also governmental organizations, banks, etc., in bringing analytics into processes with the SAS solutions, of course. I'm happy to be here.
Okay, great. Yeah, you're welcome as well. So I will just do some really short introduction into synthetic data that for everyone to be at the same page. So just one slide about Synto. So we are a startup based in Amsterdam, and we are specialized in synthetic data. We have now quite a nice and big AI team to build the solution. And also about Synto a little bit. So we have a couple of recognitions we're really proud of. So we are winner of Philips Innovation Award. We are winner of SAS Global Hackathon in Life Science and Healthcare. And also we are shortlisted by NVIDIA on a startup to watch at. And all it brings us to the question, what actually we mean by synthetic data and what synthesization we support. So at Synto and actually globally in the market, we see three different ways of synthesization. So first one is AI-generated synthetic data. It's actually when you mimic statistical patterns of original data in synthetic data with the power of artificial intelligence, and you use it for AI modeling. Second approach is a smart de-identification. When you protect sensitive information by removing or modifying personal identifiable information. And the third one, it's a test data management. When you actually create, maintain, and control representative test data for non-production environments. And a big advantage of Synto is that we have all these three synthesization processes in one platform. So I will just start with the questions. So I think the first one I would like to ask, Wim, it's to you. So the really interesting and straightforward question. So why we are all here today? So what do you see as the main data challenge we are trying to overcome?
Yeah, I think especially in healthcare, we have many challenges. Typically healthcare is understaffed, overpressured, with a high urge to be smarter, to innovate, and to be able to do so. Yeah, data-driven innovation is a potential solution that could offer a lot of value. But what we see as challenge is that if we will be able to leverage these solutions, we need to have access to the data, the data needed to build those solutions. Yeah, especially within healthcare, data is of course privacy sensitive, even more sensitive than other industries, and therefore especially healthcare faces challenges because without the data, we cannot build those solutions. And yeah, if we are not able to build those solutions, we cannot build and deliver that value. So I think that's why we're here for how we need to get the data and we need to build those solutions. And the question is how.
Oh, great. Yeah, thank you very much. To follow up on it, Edwin, I have the next one. From your experience, how can companies effectively utilize the business analytics and data science to drive innovation and actually to streamline the processes?
Okay, thank you for the question. Yes, that's very important because, well, driving innovation with analytics, it's in the core what I'm doing every day. But first, let me also explain a little bit that analytics is not really new, of course. Nowadays, we talk about synthetic data as part of generative AI, and a lot of people think, well, that's really hard and new. AI is there now actually, but it's there already for a lot of years, a lot of decades even. And so we have been driving innovations with analytics for years now. But still, what I see is that a lot of organizations fail to really bring the outcome of the analytics and the machine learning models, et cetera, into production quickly. Because, well, you build your models, you create your models, but the models only bring value, also in a hospital, when you bring the model to operational processes or to the patient or to the bedside, like we call it. And in my experience, well, this is mainly due to the lack of an end-to-end process, an end-to-end process from data to decision. And at SAS, we pioneered the analytics lifecycle. We call it the analytics lifecycle. And I think it's important to have this in place in an organization to really drive innovation and streamline your processes. It's based on three different steps. First, your data, of course, like Wim is also talking about. The data is very important. Have access to data, improve your data quality. You need to have capabilities to do this. And then the model building itself, you need capabilities. You need to be able to run a lot of experiments to see what kind of approach is the best approach, and then build many models quickly before actually decide which model will go into production. And then finally, the third step is, of course, deployment. You want to deploy the model into a production setting. Only then it will bring value, whether it's a real-time or a batch process or a streaming process. And it's key, I think, that when you see these different steps, that you have smooth transitions between these steps. And it's more or less an infinite loop. You go from data to modeling to deployment and back to modeling and back to data when you monitor something in operational processes. And then another thing that's very key is that also in these steps, you have a governance process, a proper governance in each phase of the process, not only governance on data, but also governance on the models itself and also the models, the monitoring of the models that go into production. And that also counts for healthcare. Nowadays, well, it can really bring value for healthcare organizations. But only why do I see so many models fail to go into go to the bad side? It's because of the lack of this complete analytics lifecycle implemented in organizations. And I think the synthetic data generation and generative AI can really help in this. Can support in this. Can play an important role.
Yeah. Thank you. It sounds quite complicated to innovate with the healthcare data and to bring it into the patient side. Thank you very much. Frederick, I think in this bunch of questions, I have the most legal one to you. So from your legal perspective, can you share a little bit what is complexity actually surrounding about the data exchange and data sharing, because it's the main obstacle for innovations?
Yeah, definitely. Absolutely agree with your assertion that there's a huge problem there, so to speak, legally speaking, at least. Because there are a lot of legal complexities surrounding, well, let's say data access and data sharing. And they include, first and foremost, probably when it comes to everyone's mind, data privacy laws. They're good that they're there, but they create problems, so to speak. When you want to alleviate that, well, there's a lot of solutions, but not all of them are quite as easy to adhere to or to manage or to get control of even. And that's the first problem, because data privacy exists, but then we have another host of problems. For example, like cross-border data transfers or contractual obligations regarding data, adhering to consent requirements, meeting anonymization standards, all those sorts of problems that exist, and they only exist regarding the data itself. Nevertheless, how you implement the final solution, as Edwin also mentioned. So those are just the first legal problems. And then also a legal problem that exists is perhaps often not looked at directly. Contractual obligations with other parties that supply data to you. Now, here in the Netherlands, at least, there's this very complex thing of being the owner of data, which, legally speaking, not an option, but at least we can assert control over data. And that's another thing. Nowadays, you see more and more happening that companies say, well, you get the data to achieve goal X, but the second you want to start doing other things with that data, I'm not as abiding anymore, and I want you to first ask, regardless of if it's personal data or not. So yes, a lot of problems, and a lot of problems that aren't alleviated directly in a legal sense.
Yeah, so in this case, I think we are quite happy that such a new concept arranged, like a synthetic data and some new approaches to this data synthesization. It really differs from this old way anonymization techniques. I think you bring really about also the question about the data ownership. I think it's really important. So Wim will touch upon this later. Also, how we organize the process of a platform, how we make sure data is secure and stored, and no one sees the data from besides the customer itself. So it brings us to the next question, actually, to Wim. Wim, can you then explain a little bit how actually synthetic data helps to overcome all these challenges we discussed so far?
Yeah, I think what we typically hear is the combination of symptoms that we heard from Edwin and Frederick. So ambition number one is bring value to production, meaning bring value to patients, customers, stakeholders that ultimately will benefit from the value that organizations could deliver with data. And of course, the privacy elements related to that. How can we handle that? organizations understand and know the solution, the challenges, but they're looking for solutions, and that's typically why organizations approach us, and also why we decided to build a toolbox to have synthetic data generation methods, all methods in one platform, so that you're not necessarily pushing for one solution, but really have a toolbox with all solutions in place, and that you really can explore use case specific, what is the best approach to work with that data. Is that AI generated synthetic data? Is that de-identification? Is that mock data? That's in the end the discussion that we want to have with customers. And I think that also points down to in the chain from getting from data to value. It really boils down to picking the typical use cases where synthetic data could add value.
Yeah, great. Thank you very much. Okay, so it brings us to the next question. Yeah, after that, okay, we are overcoming by these challenges, but actually what use cases we see? Because we see that a lot of trending technologies has arrive and then drop down, and we don't really see the implementation of these concepts. So this question will be to you, Edwin. So do you see any use cases? Which one, just to give an idea what we can do with synthetic data?
Yeah, I see a lot of use cases, of course, in healthcare, but also in other industries. And let me talk a little bit about the different type of use cases. I think, well, the difference, the synthetic data, the difference with other techniques is that, well, you can really create data that is very, very similar to the real data instead of, when just anonymizing your data is good enough, okay, you can just anonymize and go on. But now we have data that's really as if it is real. And I see three main applications, use cases. The first is, I think, you can create data when in situation where you don't have data. So when the data doesn't exist at all. So you can, for example, create a test data or data for demos. I do a lot of demoing in my daily job, and then I need some data to build a demo. So this is one nice use case. The second one is, okay, we have data, but we want some additional data, additional records in my data set. So for example, fraud. I think fraud is a very important one for synthetic data. You can create synthetic cases to find these cases in your data set, to build models and to find these fraud cases. Because often you only have a number of fraud cases in your data, and then of course you can do some oversampling, but really creating new data records as if it is real fraud is really a nice use case. And also in this case, for testing, you can create specific cases, special cases for testing applications with synthetic data. And the third one is, I think that's the main one, is synthesizing a complete data set or a complete database, like Synto is also doing. Create a new data set, really new data, based on the original data, but it's really new data, as if you have a new sample of the total population of all your patients. But preserving the characteristics of these patients in such a way that you really can also build the models on this synthetic data set instead of just using the original data. And in this way, it can really speed up that model building process. And a great use case for this in this third way of working is that you now can also combine these data sets together. So, for example, 3 or 4 hospitals can bring their data together to a central location where you can build models on these data. But because the original data, and Frederick, you can talk about that also, of course, from a legal perspective, they're not allowed to share their data together. But now, as a synthetic data set, first synthesize the data and then bring it together and build your models on that huge data set with all the data of all the patients in globally even. And that's a great use case, I think.
Yes, thank you for sharing. Yeah, I do believe that especially AI-generated synthetic data, it's really new concept, which really overcomes the anonymization, because you are not really destroying your data. You just create the digital twin of your original one, and you can really nicely create the models, even not to share it with everyone. So, okay, we created synthetic data, but now we have a question: what is the primary legal considerations and compliances regarding the regulations? Because all of our clients in the first meeting, they ask, okay, we will do this, but can we use it? it's legal, it's private. So how you make sure it is?
That is an interesting question. As Edwin also mentioned, the fact that, well, in the first two situations, you know, when you, for example, make something from, well, I'm not going to say nothing because a lot goes before this synthetic data exists. Legally speaking, maybe not the most interesting case. Once you have data that you want to de-identify, so to speak, then all of a sudden we're already in the domain of GDPR compliance again. So we have to consider that at the very least. Now, luckily in the Netherlands, at least, the authority has already said that in many cases, going from a data set that contains personal data to synthetic data usually constitutes a legal process that you can manage, that you can get into, so to speak. And also very interesting, you know, the fact that once you have synthetic data, because of the fact that it's no longer personal data, it no longer is data that was first and foremost in control of another company or ownership that we sometimes put on that. All of a sudden you can do, well, I want to say virtually anything. I'm not going to say that that's the actual thing you should do, but it's something you can do. You can pursue, for example, cooperation with other companies in order to see, well, I have this data set, you have this data set. If we combine, maybe we can find more interesting characteristics of our patients, so to speak. Well, that is interesting. I think there's a lot of value in there. That, however, also hinges on what I mentioned of that GDPR compliance problem. So going from or personal data to synthetic data, you do have to comply, obviously. And in Europe, we have options. In the United States, there's definitely options, but you also have to consider local laws, obviously, or state laws, I should say, because they can differ greatly. A lot of interesting points, at least, that give you the option to go to synthetic data.
Yeah. I think it's also, we'll speak a little bit about that. It's a great that they don't really deviate synthetic data as a different type of anonymization or the identification. So in this case, we don't have any new laws coming up regarding to this. So if you already compliant with HIPAA and GDPR and you follow the rules, you can use synthetic data right away. So not an obstacle for now.
Yeah.
We'll see, you know, you never know what will change.
At least nothing in the pipeline that I'm aware of. But
okay.
I do think that there's an interesting case to be made regarding the Artificial Intelligence Act that's coming up in the European Union right now. But that more focuses on the issues that Sinto will be facing regarding how they go from A to B as opposed to a company using synthetic data.
Yeah. Yeah, I think Wim also will answer this question. We have some workarounds, you know, as every company, guiding our clients to do it secure, nice, and not to have any issues through the process.
Very good.
Yeah, super. So I think I have the 3 last questions for today. Thank you for your comment, Frederick. So Wim, can you share maybe a little bit about some specific challenges when you actually introducing synthetic data into organization workflow? So how they will how they will organize this process? It will be something new, or it's easy to build in an existing pipeline?
Yeah, so I think one of the typical questions that we always received, as specifically with AI-generated synthetic data, where we focus on today, is how accurate is the synthetic data in comparison to the real data? And we will deep dive into that later today. The other topic is what was addressed by Frederick, how you get from real data to synthetic data. Explainable AI is something that gets more and more important. How you have to explain how that works, and we make sure that we have that covered as well. But yeah, what we typically see is organizations try to generate synthetic data by themselves, and they typically face challenges related to data complexities. So time series data is typically complex to generate. They typically relate to challenges around scaling it within the organization. So typically generating a synthetic data set on a small scale is easy, but yeah, you need to do that on a larger scale to also bring synthetic data to production. Yeah, and I think that's typically where we come in, and also where we will deep dive in later today.
Right. So it also brings us to the point to question to Edwin, because okay, clients did synthetic data, right? But then you need to do the data analytics based on it. So can you provide a little bit some insights into the best practices of effectively implementing synthetic data strategies with healthcare organizations?
Yes, of course. Great question. I think first of all, it's very important to think about the use cases in your organization, and then see what kind of accuracy do you need. So for example, for just creating test data or demo data, you don't need that high accuracy as when you want to use it for building AI models based on this synthetic data set. And that's something that we also did together with Synto, that we tested the outcome of the results of a Synto synthesization with the Synto engine, creating models on the original data and the synthetic data. And the outcome was very, very promising, that you can really build models on synthetic data and then afterwards use it on the original data. And that can be can be nice to build an implementation strategy, because then I want to reflect to the first question that you had about, and I talked about the analytics lifecycle. And you need that end-to-end process when you want to build an AI strategy. But then when you want to use synthetic data in that strategy, that you need to implement it somewhere in one of these phases. And I think the most promising phase is, of course, after accessing the data. Always you need to go to the original data, of course. Somebody has to access the original data. But when you synthesize the data immediately after that, then you can have a less risky process, and more people can collaborate in using this synthetic data when going to the next phase, the modeling phase. So then you can model on the synthetic data, create your models, test the models, and decide which model should go into production. And then bring that, synthetic model, actually it's a similar model as a real model. It's just a machine learning model. And bring that machine learning model in the third phase, the deployment phase, where you inference new real data that's coming in, while the model has been trained on the synthetic data. And we proved that the outcome and the results are very similar to in this case. So you don't need to retrain on the original data anymore, and that's very beneficial. But of course, also don't forget to implement that the governance process in all these phases. Governance on data, on models, and on inferencing in deployment. And then it will really bring less risk, so people can really collaborate, shorter development cycles, and really it opens the way to collaborate also in healthcare, bringing the data together. And preserve privacy, of course, but really create a nice machine learning model. So it's a really enabler in this way for new innovations, I think, in healthcare.
Yeah, that's a great point. I think especially with the data access timeline. So what we face so far when we speak with the customer, especially in owners of a patient data and a healthcare data, they share with us that to get the access to the data, it takes from 6 till 12, even sometimes more time, months. And then they told, when we get access, we suddenly understand we need another data, because then we overthink what we would like to do, what advices and insights we would like to bring to doctors and patients, and then suddenly you need to go through this process again. So yeah, I think it's a different approach than while you maybe even get the access to the full data, you already can innovate with synthetic data and already have a model in 9 months, not just get access to the data. Great point. Thank you very much. And I think to sum up all these questions and discussion we had today, I would like to ask Frederick, okay, what is your legal advice? We know how to synthesize the data, we know how to build into the workflow, and then we can use it for analytics. But what advice you would really give to the organizations and managers now listening to this webinar about the implementing synthetic data solution in a healthcare from a legal standpoint?
Yeah, thank you. Well, first and foremost, it's probably best to first think before you act. That means thinking about why do I want to use synthetic data and how can it help solve a problem that I might have. Now, those are questions that you should be asking Wim Kees and not me. Nevertheless, once you start doing this and once you start thinking about using synthetic data, it also really hinges on what we talked about before. Like, are you going to use data that you currently possess, or are you looking at other uses of synthetic data? And that data that you possess, whose data is it in the first place? So you need to conduct, and I'm very happy also with Edwin's advice of using a lot of governance strategies in between the entire lifecycle process and starting again and again. I mean, you need to conduct risk assessments, and you need to start doing that even before you start using it, probably from the second you start thinking about it. And based on that risk assessment, you will eventually also get to ensure regulatory compliance, depending on your context, depending on whom you're working with, and what you eventually want to achieve. Now, another interesting topic is liability in that sense, because training a model based on synthetic data will lead to one case, but then using real life data based on that or in that same model can lead to another situation that you need to be aware of. And in that sense, liability also comes into play. Sadly, also from a legal point of view, because obviously liability is legal, but in the sense of AI, this even becomes more prominent with a new act that is coming at us from a European point of view. Now, once you take all these into consideration, you also need to be aware of the fact that you have certain compliance or directives actually that you need to look at when considering the security of the data. Even when it's synthetic data, it can still hold a lot of value, maybe just for you, but sometimes also for your competitors. So you want to be aware of what is actually in the data and how you go from A to B using that data and to whom it concerns. You might want to keep it a secret. And then obviously, lastly, you need to consider all the contractual agreements or obligations that you have regarding certain data. Even when it sometimes concerns synthetic data, sometimes the contractual obligation can be in the actual value that's in there as opposed to the actual data itself. So I would just go back to my first answer, which is you need to conduct a thorough risk assessment. And you need help with that because you need to look at a lot of factors. So it always helps to get outside counsel in the sense of bringing in information and different viewpoints. And they don't necessarily need to be legal viewpoints. You also need security and more of cybersecurity, I should say. And also people like Wim Kees themselves who can actually tell you about what the AI is doing.
Yeah, it's true. What I'm doing, what AI is doing, and how we can really make sure it's doing the right thing we are looking for.
Yeah.
So thank you very much. Thank you, Edwin. Thank you, Wim. Thank you, Frederick, for this great discussion. We had it a little bit longer than we planned, but I do believe because it's really enjoyable, you know, to see this feedback from different areas about synthetic data. So thank you very much for coming. Thank you for sharing your ideas and your experience. Yeah, I would like now to give a floor to Wim Kees because after this great conversation, we would like to go deep into synthetic data and really share how it can be used, the flows, the process, to give you some step-by-step understanding into this.
Thanks. Yeah, looking forward to provide a further deep dive into synthetic data generation. Yeah, so yeah, basically the starting point is, as we discussed, if we want to innovate in healthcare, we typically face challenges relating to privacy, as the original data is privacy sensitive. Yeah, so first I would like to share some quotes with you, and I will share the slides with you after this webinar, so then you will have them as well. So on the left side, some quotes from the GDPR, in the middle from HIPAA, and on the right side also about privacy consultants, all suggesting organizations to start exploring the use of synthetic data. Yeah, and I think that is really the starting point, because synthetic data generation is a new technique. Yeah, and I think that is what a lot of organizations see. There is potential, and yeah, many organizations, especially in healthcare, face challenges around how to start, where to start, and how to scale with that. As we are in a webinar related to healthcare, I will typically share the organizations that we are working with within healthcare. So yeah, within healthcare, we typically work with either hospitals that, of course, are aiming to improve patient care, pharma and life science organizations who aim to conduct clinical science studies, clinical trials. Academic research, really doing research with healthcare data, and of course also health tech organizations building new technologies. This slide is a slide that you can deep dive into later. The solutions that we provide are mentioned by Juliana. So AI-generated synthetic data, smart de-identification, and test data management. Today, we will focus on AI-generated synthetic data, but I would quickly like to highlight the tools that we have in our platform. So as mentioned, AI-generated synthetic data on the left, we really aim to mimic statistical patterns of original data in synthetic data with the use of artificial intelligence. And with that, 3 key pillars. We provide a quality assurance report for every set that we generate, where we compare original data with synthetic data on accuracy, privacy, and speed of generation. Yeah, we also collaborate with SAS to have some external evaluations. And yeah, we optimize our platform to be able to support the most complex time data structures, such as time series data. But next to that, we also support for smart de-identification, which is aiming to protect sensitive information by removing or modifying personal identifiable information. PII, with PII, we typically talk about first names, last names, social security numbers, bank account numbers, any attribute that directly links to an individual. And to that, we aim for a smart approach. So we have an AI-powered PII scanner that's able to scan a database on PII attributes. We can replace them by synthetic mockers, synthetic mock data. And we support for consistent mapping, so that we consistently can map the same value to preserve referential integrity across tables, databases, and even systems. And finally, test data management. That's the goal, to create, maintain, and control representative test data for non-production environments. That consists of de-identification and synthesization. We try to mimic a production data set as closely as possible, but we also aim to enhance it, because typically not all test scenarios are covered with production data. Rule-based synthetic data to enhance that, and subsetting can be used if you have a huge data landscape to make it smaller in a way that preserves referential integrity. So this is a full toolbox. As mentioned, today we are going to focus on AI-generated synthetic data. And yeah, for organizations, we typically ask, why use real data when you could use synthetic data? On the one hand, because it can allow organizations to minimize personal data without hindering anyone. And on the other hand, it could unlock data that was initially restricted due to regulations, or it was simply too time-consuming to access. And that's ultimately your strong foundation to boost data-driven innovation with less risk, more data, and faster data access. And of course, this unlocks a wide variety of use cases to apply synthetic data in. Yeah, and for that, I would like to also take you together with Juliana in a journey in the typical use cases for synthetic data generation. As mentioned, if you have questions, feel free to put them in the chat. Then we can cover them after the webinar.
Yeah, and also Frederick mentioned that you also can ask some legal questions you still have, and we can put you in contact with him afterwards to cover them as well. Yeah, so speak about synthetic data use cases. We see really strong 3 use cases now. So first one is about analytics, second one is about test data, and the last one is about data sharing. So it was also the question, okay, about the governance of data models and even for synthetic data models. So I would like to give you briefly the overview how our clients work with synthesization and synthetic data. So first of all, you have original data and you install Synto on premise or on cloud, but on your secure infrastructure. So we don't have any access to the data. It's not leaving the organization. It's really important to highlight. And then you create synthetic data, and then you do the model development. But what's really important, the last step, you do the model scoring actually based on real data. So it's ranging actually from business intelligence to artificial intelligence solutions you may build with synthetic data, AI-generated synthetic data. The second use case, it's not new concept, I would say, so test data management. But with the AI and with the synthetic data, it brings really minimize the complexity of this process. Because as we have a production data, and then through the engine, we can run into the identification and also create the full process of test data management with synthetic data. And it saves you a lot of time and efforts to create production-like data, to have up-to-date data, and to create new data. Because it's really important to have all these options within your test environment to do it easy and scalable. And it really helps you to enhance production data because production data is not covering all test scenarios because you all the time have new features and upgrades. So with synthetic data, you can enhance production-like data. And the third one is data sharing. That is why we have really big crossover here, because it's really, really hard actually to share the data across the organizations, even if it's your hospitals in different locations. You need to go through a lot of processes and have really costly data sharing, real data sharing solutions. So Wim will present one of the case studies we had really to touch upon this really important use case. That is why when you're actually using synthetic data, it's not really covering any sensitive data anymore. You can share it more easily. For sure, you would like to do it in a secure way. It's really important and have a lot of insight, but it doesn't have so much regulations upon sharing the real data. So now I would like to invite Wim to do the case study overview.
Thanks. And yeah, indeed, with synthetic data, you can, of course, realize a lot of value. But I think, we also wanted to make it a little bit concrete, go through an actual use case, had to show a little bit how this could work in practice. So with this, we have one use case that we work together with one of the leading hospitals in the United States, Cedars-Sinai, the best hospital from California, second best hospital from the States. We are collaborating with them. Good to mention that this patient is from their training lab, so it's a synthetic patient. So don't be scared about that. But what do we typically do with these organizations? That's typically around research, and Typically, that can be cancer research, clinical trials, data science initiatives, data sharing within the industry with stakeholders. Those could be PhD students, researchers, staff, stakeholders, startups that might want to do a pilot. Instead of working with real data, you could work with synthetic data, rare category diseases, for example, also the onboarding of new employees. You need to train them with your electronic health record systems, and typically you don't want to do that with real data. Here I would like to highlight a use case that we did also together with SAS, with a hospital. Before we started with this use case, we also conducted an assessment of the synthetic data and how accurate is synthetic data in comparison to the original data. And what we see here is the correlations, the relationships of variables from a healthcare data set. And we basically see the stronger correlation, the stronger the color intensity. And we see that is well preserved in the synthetic data. Also, the area under the curve had a measure of model performance. If we train models on the original data, train the same model on synthetic data, will the outcomes be similar? And that's basically also what was demonstrated here by the use of SAS VIA. And finally, we also assessed, do the same variables have the same predictive power? To assess if that was also similar, and also that was approved. So I think that was the starting point of this case study, to really assess is synthetic data viable as even for the development of predictive models, and that was successfully approved. So that was actually the starting point of this case study, and this was about predicting deterioration and mortality as part of cancer research on synthetic data. With a leading hospital. As already mentioned, of course, we are talking here about patient data. And in this case, of course, the most sensitive kind of patient data that tells everything about the health position of individuals to a severe disease. So synthetic data was used for that internally to build models. And we are happy to share that we, in this case, were able to develop those models on the synthetic data set. Had to predict, in this case, the target status with deterioration. We were able to reach an area under the curve of 0.74, which was conducted with SAS VIA. So I think that was a really interesting conclusion, because here we were really able to demonstrate that privacy-sensitive healthcare data can be unlocked with synthetic data within the hospital to realize those data-driven insights. In this case, with less risk, more data, and faster data access. And actually, this was the starting point of this case study, because the hypothesis was that if we synthesize data sets from 2 hospitals, are we able to have a more enriched, diverse data set that could have a positive impact on the predictive power of the models? So in this case, we synthesized 2 different data sets from 2 hospitals and used those as input to train a model. And here we are really happy to demonstrate that we were able to reach an area under the curve of 0.78, increasing the predictive power of the models, and thereby also demonstrating the relevance of being able to use and share data, because the better we are able to use and share data, the more positive effects it could have on the predictive power of the models. So I think that is really interesting to see, and also to summarize, if we build predictive models on synthetic data, we are really able to have similar results, but also demonstrated the relevance of being able to use and share data, because that allows ultimately organizations to collaborate on data, which could have a positive impact on the predictive power of the models. And of course, that could have a positive impact in terms of value that those organizations could bring to patients. So this is an interesting use case that we wanted to share with you as inspiration. And of course, we are more than happy to deep dive together with you more into the details. And yeah, finally, I think, how did we generate the synthetic data? Yeah, our Sinto engine is used for that. That's our synthetic data generation platform. And this platform is optimized in 3 pillars. So first, of course, privacy by design. So we deploy our platform in the safe environment of our customers so that we can really synthesize at the source. And so that Sinto never sees, processes, or receives any of the real data. Second is accuracy. So yeah, we always aim to mimic the original data set as close as possible, even for the most complex data structures, such as time series data. And ease of use, so that anyone can easily work with our platform without the need of having extensive knowledge related to data and AI. And yeah, I would also like to show you how this actually works, because I think, yeah, a lot of organizations, they want to see it, they want to understand how the platform works. Today, we do not have to have the time to do a full demo, but I would like to give you a short overview about yeah, how the platform works. So first, to give you an idea about yeah, deployment architecture. So we typically yeah, provide our platform via Docker or Kubernetes so that we can deploy in the safe and trusted environments of our customers. And on top of that, we have yeah, Sinto web user interface that our customers can use. But we have also a REST API so that it can be integrated into a pipeline. For now, I will show the web user interface that our customers use to synthesize data. And to synthesize data via our platform, yeah, we work with workspaces, which is basically an environment that can be set up to synthesize data. To set up a workspace, we need to connect to data. We need to connect to the source. That's where the original data is stored. And we need to connect to the destination database. That's basically where we want to write the synthetic data to. And with that, you will have an end-to-end integrated approach. Yeah, we support various connectors so that you can connect with your data. These are the default connectors, but we have many more connectors available to connect to your database. For now, I will open an existing workspace. So we have here a COVID patient sample database that we use. Yeah, and from here, you can configure your synthetic data job. So first, you will see on the left side all the tables that are in the database. And we have the sections synthesize, de-identify, and exclude. If we position a table under synthesize, and then basically the full table will be synthesized with the power of artificial intelligence. And yeah, you can easily drag tables either to de-identify or exclude, depending on your preferences. So that's something you could configure. Maybe interesting for synthetic data generation. On the right side, we see the number of rows to generate. By default, that's set on the number of rows in the original data, but you can easily change that to, for example, upsample your data. And then from there, yeah, you can yeah, press generate, and then the full table will be synthesized with the power of artificial intelligence. To finalize, I would like to quickly show our quality assurance report where we compare yeah, original data with synthetic data. So basically what we see here is the set that we just synthesized with in gray the original data and in green the synthetic data. And we see some categorical values and some continuous values. And yeah, as mentioned, we aim to mimic the statistical patterns of original data as closely as possible in the synthetic data. So here we see, for example, how the healthcare coverage, healthcare expenses, and many more variables that we had in that table. Also, the correlations are preserved, the relationships between variables. Yeah, they're indicated here. And as you can see, the correlation matrices are well preserved. And finally, we have also the bivariates, and then we have the combination of variables, and then it gets a quite extensive report because of course there are a lot of yeah, combinations possible. So this is yeah, the high over yeah, demo of our platform. Of course, this was a 5-minute demo. We are more than happy to also host a full demo to make sure that you can understand our platform. We will share after this webinar with you of course, the slides, and we will also share with you the user documentation, the link to book a one-on-one demo or deep dive with our team, and we will also include a special offer to work with our platform. With that, I think if there are questions, feel free to put them in the chat. Or feel free to put them in the mail. We will make sure that we will answer them all via the email, so that you have your questions covered. And if that is relevant, we can also deep dive together with you after this webinar.
Yeah, I think I can share one which was asked by different people. It's about PII. So how we identify PII, how flexible we are to define what we are including, excluding, how we mock data. So maybe you can show briefly regarding that.
Yeah. So I think in our user documentation, you will see all the elements that we can scan on. In general, you can configure that in our platform. And I can also quickly show how the PII scanner works. So if we go, for example, to this patient table, we have here the tab PII, and yeah, this is basically the area where you can run the PII scanner. We will have a shallow scan and a deep scan. Yeah, the shallow scan scans basically only on the metadata, and the deep scan also scans on the actual data itself. And as you can see here, all the PII elements are indicated. So for example, the address, driver ID, first name, last name. And what you can do with our platform is easily configure what we call mocker, so synthetic mock data. So in this case, we can configure the first name with a first name mocker. So yeah, in this case, we will replace all the first names with a synthetic mock value. And yeah, that is basically how it works. And yeah, it's good to know that all the mockers are available in different languages, and that we have over 180 mockers to make sure that we can have representative synthetic mock data. If there are more questions on this, we can of course do a more extensive demo.
Yeah, I think we answered the other questions just privately, and yeah, it's already 7 p.m. In the Netherlands, so really appreciate everyone who joined so late from European audience, and also for from United States audience. Good morning, I would say. So really happy to just to follow up. After that, we will share the recording and materials, and if you have any questions or ideas, we can just have a next meeting and deep dive into synthetic data and Synto solution. Wim, do you have any final, I don't know, notes?
Yeah, thanks all for joining this webinar. As mentioned, we will reach out to you with a recap mail containing the slides, the user documentation, and feel free to reach out for any questions or further deep dive. Thank you all for joining, and enjoy your evening, day, or afternoon, and hope to speak soon. Thank you all.
Thank you.